According to a recent study conducted by the Department of Health under the Renal Disease Control Program, every year 10,000 Filipinos develop kidney failure. 31% of these sufferers have the most advanced stage of the disease. All of them require dialysis for life or kidney transplantation for survival. While the facts are alarming, there is no reason to lose hope. One center is committed to help patients with chronic and end-stage renal disease. Welcome to St. Luke's Center for Renal Diseases and Transplant Services, the state-of-the-art facility that offers renal replacement therapy.
Chronic kidney disease is a condition characterized as a progressive, irreversible loss of kidney function. And the most common cause of chronic kidney disease is diabetes mellitus, and this is followed by hypertension, chronic glomerulonephritis, kidney stones, and chronic urinary tract infection and adult polycystic kidney disease.
So when you're talking about chronic kidney disease, basically you're looking at the timeline, how long the patient has had their kidney problem for. This can manifest as either elevations in the patient's lab values, their serum creatinine, or manifestations of abnormalities, for example, in their urinalysis, like proteinuria. Typically, when we say the patient has chronic kidney disease, they would have had this problem for more than 3 months. Most of the time, these patients will have problems with trying to accomplish two of the more important mechanisms of the kidney, which is trying to regulate the fluid balance as well as trying to remove excess toxins and waste products in the form of urine. When you're talking about end-stage renal disease, these patients are the ones who have lost a significant amount of the filtering capacity or the cleaning capacity of the kidney. Typically, they've lost about 85 to 90% of their kidney function, and most of these patients will require supplementation in the form of renal replacement therapy, as we call it, either through dialysis or transplantation of their kidneys in order to support their kidney function. So, when you're talking about the major causes of chronic kidney disease and end-stage kidney disease or end-stage renal disease, the number 1 and number 2 causes of these problems are going to be diabetes and hypertension, which will make up about 2/3 of the cases. Other causes which may give patients what we call kidney problems are going to be those that are like hereditary disorders such as polycystic kidney disease, problems of obstruction such as kidney stones and bladder outlet obstructions, recurrent urinary tract infections, or other problems such as immune system disorders like lupus.
The Center for Renal Diseases and Transplant Services offers major renal replacement therapies that enable ESRD patients to live as best they can. Hemodialysis, peritoneal dialysis, and kidney transplant.
The Center for Renal Disease offers a variety of modalities, like the hemodialysis and peritoneal dialysis. Now, regarding hemodialysis, we have variations in the treatment. We have, of course, the regular for our conventional hemodialysis. We have the slow extended daily dialysis or SLED. We also have the CRRT or the continuous renal replacement therapy, and the most recent would be your online hemodiafiltration or online HDF.
Hemodialysis is the most predominant technique for treating ESRD worldwide. In hemodialysis, an artificial kidney called a hemodialyzer is used to remove waste and extra chemicals and fluid from the patient's blood. St. Luke's is the first tertiary hospital in the country that offers online hemodiafiltration or online HDF. Studies have shown that using online HDF to treat patients with chronic kidney failure can lead to a significantly lower risk of mortality compared to treatment with standard hemodialysis. It could contribute to reducing cardiovascular complications, which account for about 50% of all deaths among dialysis patients. It also has the advantage of improving the control of blood pressure and anemia. Peritoneal dialysis is an equally effective treatment like hemodialysis. In peritoneal dialysis, the patient's blood is cleaned inside the body. The doctor places a plastic tube called a catheter into the patient's abdomen or belly. The blood stays in the arteries and veins that line the peritoneal cavity. Extra fluid and waste products are drawn out of the patient's blood and into the dialysate. Kidney transplantation is the process where a new kidney is obtained from a compatible donor and surgically implanted into the ESRD patient. Presently, our transplant services include living and deceased donor kidney transplantation. Living donor transplantation involves transplanting the kidney of a living donor to the recipient. Deceased donor kidney transplantation would involve placing the patient on a wait list before the actual transplant can take place. We are proud to be one of the few centers in the country capable of completing all the requirements for donor and recipient evaluation as well as the corresponding workup without the need for referring to an outside center. This increases efficiency and will ultimately save the patient time and cost.
So with regards to the staff of the Center for Renal Disease, I think you can take comfort in knowing that you're in the hands of probably the most well-trained and most well-equipped physicians, nurses, and surgeons in the country. Most of our physicians and surgeons have experience or training, not just locally, but at some period in their careers, even abroad.
Through the years, we have already developed or established a very effective and systematic, holistic approach in the timely management of our kidney disease patients. And to ensure the delivery of adequate treatment, we hold regular quality assurance meetings in order to ensure the delivery of a safe and quality treatment of our patients.
With the Center for Renal Diseases and Transplant Services, patients now have access to ideal solutions to help them better deal with kidney disease. Visit St. Luke's Center for Renal Diseases and Transplant Services and discover how our expertise will help sustain the quality of life of patients with kidney problems. St. Luke's Center for Renal Diseases and Transplant Services, the expert in kidney health. Ultimately, it is expertise.